Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
Tracy, there are lots of people who come to the Mayo Clinic every day, but there are not many who know as much about our institution as Dr. Len Berry. As a visiting scientist at the Mayo Clinic in 2001-2002, he conducted an in-depth research study of healthcare service and ended up writing a book. It was called Management Lessons from Mayo Clinic, along with the former director of marketing at Mayo Clinic, Dr. Kent Seltman. Now, Dr. Berry is a university distinguished professor of marketing, Regents Professor, and holds the M.B. Zale Chair in Retailing and Marketing Leadership in the Mays Business School at Texas A&M University. Big deal.
Yes, Dr. Berry has written 10 books in all and is the author of numerous academic articles and an invited lecturer throughout the world. He's received more honors and awards for his contributions than we have time to mention. Dr. Berry has a particular interest in cancer patients and their care, and we are privileged to have him as our guest on Mayo Clinic Radio. Welcome to the program, Dr. Berry.
Thank you.
Dr. Berry, nice to see you. So tell us why you're in Rochester. I hope for nothing malady.
No, I'm actually in Rochester because tonight is the annual May Berry Service Excellence Award. May Berry is my late mother, and it's an award that I created to honor my mother's memory, as well as to celebrate the incredible service that I saw when I studied here at Mayo Clinic.
What's your particular interest in cancer patients and that care?
Cancer affects us all. Sooner or later, directly or indirectly, cancer touches us all. And I've been studying healthcare for almost 20 years now. I started at the Mayo Clinic with my visiting research project at the Mayo Clinic, and started to get interested in cancer. And at this stage of my career, I just feel that I can make a contribution to improving the service experience that patients and their families undergo when cancer strikes. Cancer is a life-changing experience. It may not be life-ending, but it's always life-changing, and it impacts the family, not just the patient. So I'm trying to help smooth the path that cancer families go through.
So tell us about this article that you wrote in, I think it was 2017, and it was called The Role of Kindness in Cancer Care. Why'd you write that article?
I wrote that article because when cancer strikes, Tom, it's an emotional set of diseases, and true kindness can help defuse the emotional intensity that accompanies cancer. True kindness can go a long way to calming the patient, to giving the patient confidence, to giving the family confidence about the path that they're underway.
What do you mean by true kindness? What are some of the examples of that?
Well, one form of true kindness is true listening. I call it deep listening in the article, which I wrote with collaborators, with co-authors. Deep listening or true listening is being present for the patient, not being distracted, and taking the time to find out what really matters to the patient, their values, their preferences, and taking the time to hear the patient's story. That's kindness, and too often it's in short supply in healthcare.
Other ways that the healthcare team can show kindness.
Generosity. Generous acts is the term that we use in the article. It's generous acts often manifest themselves in terms of just extra effort. It's often something that seems quite small or unimportant maybe to the clinician, to the nurse, the doctor, or the administrative assistant, or the desk attendant, but it means a ton to someone who's under tremendous emotional stress. Generosity. Let me give you an example. One of my friend's child has brain cancer, has gone through a lot of treatment, And when he would get his regular radiation treatments, he needed to go under anesthesia. He was 4 years old. And that, of course, was frightening for him. And so his mom asked, "Can my child sit on my lap when you put him under anesthesia? He'll be more comfortable that way." And they did that. And then when he would wake up from anesthesia, he'd wake up without a shirt on, and that upset him. So the clinical team would always put a shirt on before he would wake up. A very simple act, but it meant a lot to the family.
So how do you, I think I totally agree with everything that you say, but how do you teach a culture of kindness to a medical institution, no matter which one? I mean, you're talking about the whole healthcare team, and it seems like there are people on the healthcare team who are kind just by nature, and some not so much. So how do you teach everybody on the healthcare team this kindness concept?
It starts with being a kind organization. You can't be an unkind organization and treat your employees unkindly and create a culture of kindness.
So it starts at the top, pretty much.
It starts at the top. Another key is to try your best to hire kind people in the first place.
Not always easy.
That helps a lot. And also not tolerating offensive behavior on the part of the staff. So if you make a mistake in the hiring and you have someone that's rude, that's unkind, either to their colleagues or to the patients or both, families, you need to take that person out of the organization. Have the courage to do that. To create a kind culture, everybody needs to play their role. Everybody's responsible. Everybody has to be a role model for kindness. And then it becomes more infectious, and it spreads into the culture.
If someone is not kind to a patient or to a family, whose job is it? Whose responsibility is it to take that person aside and talk to them about kindness? I mean, that's so difficult.
Yes, hopefully a trusted colleague who, perhaps a friend, who can take someone by the shoulder into a private space and say, you know, Joe, there's a better way to have handled the situation that I just observed. And I hope you don't mind, but I'd like to talk to you about that, because it would have meant so much to the patient had you handled the situation differently. And I think it would have meant more to you in reflecting on the day when you think back on the day today. So we need mentors to build a culture of kindness. We need role models, not only at the top, but in the middle. Because in a big organization such as Mayo Clinic, everybody works for middle management. They don't work for the CEO. They work for their supervisor, their immediate supervisor on the day-to-day basis.
Who did you want to read this article? I mean, is this for everybody on the healthcare team?
I wanted clinicians in particular to read this article because it's easy to take for granted. I'm a kind person, but the pressures of the day in healthcare, all the external forces and management asking you to see more and more patients and a full waiting room, and you're running behind. It's easy to fall into a form of abruptness, a form of impersonalization that isn't really reflective of kindness. And kindness can be so important to the patient and the family.
Particularly if cancer is the diagnosis.
Cancer is the scariest word, I think, in all of healthcare. It is the scariest word. Can I tell one more story about kindness?
Okay.
Is it okay?
Sure.
So this is a story about timely care. This is also another form of kindness we write about, is timeliness of care. Because when patients are really stressed and emotionally uptight. They're waiting for an appointment. They're waiting for a test result. Timeliness is critical. Undue waiting is suffering. And so one of the patients I interviewed in my research on cancer care was a patient that was treated here at the Mayo Clinic. And the patient had had surgery for his cancer and had an appointment the very next day with his surgeon to review the lab results and the imaging that had been done the day before. And he was particularly nervous the night before this appointment. Are they going to find some cancer again? He was really upset. He just couldn't function that night. And just before dinner, he got an email from his surgeon. And his surgeon in the email said, all the tests look good. That was such a kind act. I wanted to tell this story because that surgeon was you, Tom.
I'm so glad we invited him.
Is that true?
He probably is.
Oh,
Dr. Len
gosh.
Berry, a distinguished professor of marketing at Texas A&M University and an expert on healthcare delivery. We'll take a short break. When we come back, we'll talk about another article he has recently published.
That's putting healing back at the center of healthcare.
Welcome back to Mayo Clinic.
Go ahead.
Welcome back to Mayo Clinic. Is it going? Oh, sorry. Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
We are talking with Dr. Len Berry, distinguished professor of marketing at Texas A&M University. We've been talking about the importance of kindness in the care of patients who have cancer. And now we want to talk about a different article that Dr. Berry has also written, and it's called Putting Healing Back at the Center of Healthcare. Mm-hmm. Putting Healing Back at the Center of Healthcare, with co-author Dr. Raina Audish. Now, she's written a book that was called In Shock, My Journey from Death to Recovery and the Redemptive Power of Hope. She was your co-author on this article, right?
Yes.
So tell us about this doctor and this book. I have not read the book, but I've looked at some of the reviews, and it sounds fascinating.
It's not only one of the best healthcare books I've ever read in my career, it's one of the best books I've ever read. I highly recommend this book. It's a beautiful book about a critical care physician, ICU physician specialist, who works at Henry Ford Health System in Detroit. She's 7 months pregnant, and she's eating dinner out at a restaurant with a friend, and suddenly she has very sharp pains in her stomach, and they rush her to the ER. And it turns out that she has a very serious condition related to her pregnancy. I won't spoil the story for those who will read the book, which I hope will be a lot of people listening to the show. But she wound up being a patient in her own hospital for months, a number of surgeries later, and she came very close to dying. In fact, one of the chapters in her book is about when she died, even though she didn't. She came that close. And what's so powerful about this book, Tom, is you have a physician that's used to treating critically ill patients, an ICU physician, who herself becomes critically ill and has the experience of being a patient and hearing everything that goes on, seeing everything goes on in her own hospital, and writing a really brave and honest book about what went right and what didn't go right. And she admits in her book, I'll just finish with this story, she admits in her book that she, as a physician, used to say a lot of the same things that she overheard as a patient that she would say that offended her, such as, "You're trying to die on us," or "The patient is circling the drain." And she used to say that. And her illness, her experience just changed the way she practices medicine.
Well, I would expect that's the title, Putting Healing Back at the Center of Healthcare, then that makes sense,
Yes.
that she would be your co-author.
Yes, she and I have written a lot. We've become very close friends. She's a brilliant brilliant person, a wonderful writer.
Why does she propose that healing needs to be put back into healthcare?
Because we're losing sight of that in healthcare. Healthcare is becoming, not in every health system, but in many, too corporate, too businesslike, too financially driven, too fearful of the future. You know, if this political thing happens or that political thing happens. And we're losing sight of the sacredness of healthcare. The healthcare is to heal. And when we write about healing in this article, we write about healing more broadly. Healing isn't just about cure, because sometimes cure is impossible. Healing is about healing the patient holistically, healing the patient physically if possible, helping the patient heal emotionally, helping the patient heal spiritually. And so we write about healing in multiple dimensions rather than just as a physical type of healing.
So as you put it in your article, healthcare is becoming less focused on the intrinsic goal of healing and more on external forces that impede it, the forces that you just talked about.
Yes.
Now, the title of her book, again, is In Shock, My Journey from Death to Recovery and the Redemptive Power of Hope. And I know you wanted to talk to us about the two different types of hope.
Yes, the type of hope that is most familiar in healthcare is hope that we call focused hope. And focused hope is focused on the future, a future goal, the goal of remission or the goal of cure, the goal of getting my life back to where it was before I got sick. That's focused hope. And in healthcare, that's oftentimes the only kind of hope we think about, which is unfortunate because if cure isn't possible, if remission from a cancer isn't possible, then we fear, oftentimes as physicians, we fear that the patient will give up hope if we can't really cure the patient physically.
So that's focused hope.
That's focused hope. But in fact, there's several different kinds of hope that a physician can help a patient and a family gravitate to over time. It's not easy. It's not an easy journey. And the type of hope that's possible, even if cure isn't, we call intrinsic hope. And intrinsic hope is centered on the present. It's more of a reflective type of hope. Hope for a good day. Hope for seeing my grandchildren today. Hope for eating a delicious dinner that my spouse prepares, my favorite dinner in my home today, rather than being in the hospital. So intrinsic hope, when people are seriously ill, becomes a really powerful form of healing when cure isn't possible. But Tom, people are alive until they're not. And we can do such a better job in healthcare in helping people live higher quality days of life as long as they're alive. And that's what intrinsic hope is about. And finally, there's a third type of hope, an even higher level of hope. And we call that freedom hope, hope for freedom. And that's when someone is so seriously ill and in so much pain, and the family is in so much pain, emotional pain, that it's just time to free the patient. Free the patient from the hospital, free the patient from all the treatments, free the patient from the pain, and free the family. And so we think of hope in multiple dimensions, not just hope for cure.
So inspiring to listen to you.
Thank you.
Dr. Len Berry, Distinguished Professor of Marketing at Texas A&M University and an expert and respected authority on healthcare delivery, with great advice for anyone involved in the care of patients. Number one, all patients need healing. And number two, nowhere is kindness more important than in caring for patients with cancer. Thanks for joining us, Dr. Berry.
Thank you.